This presentation is about dementia and has been designed to help you support your relative with their illness. The learning aim for this presentation is to explain what dementia is and what it means for relatives. The learning objectives for this presentation are to define what dementia is, to identify certain aids which could help your relative, and to determine what help you personally may require. In the UK, there is an estimated 850,000 people with a diagnosis of dementia, which is expected to rise to more than 1 million by 2025. 1 in 6 people over the age of 80 have dementia, however it is not a normal sign of ageing, with 40,000 people under the age of 65 suffering from the disease. 2/3 of dementia patients are women, although it is not clear why there is a stronger prevalence amongst females. Also, 80% of care home patients have some form of dementia, but over 60% of dementia patients continue to live in the community. Dementia is an umbrella term used for symptoms caused by damage to the brain. These symptoms include memory loss, difficulty solving problems, and can also include mood swings. The two most common types of dementia are vascular dementia, where oxygen supply to the brain is cut off, such as after a stroke, and causes brain cells to die, and Alzheimer's dementia, where a build-up of proteins cause nerve cells to become blocked. There are many other forms of dementia, however, including Korsakov's syndrome, Binswanger's, Lewy body dementia, and many more. There are also certain conditions which make a person more prone to dementia, such as motor neurone disease, Huntington's disease, and Down syndrome. Some activities have been linked to the development of dementia as well, including smoking, excessive alcohol intake, and an unhealthy diet. When a person has dementia, their brain is affected in different ways depending on the form of dementia they have. However, the most common forms start with shrinkage of brain tissue. As the disease progresses, the damage to the brain spreads, meaning the same symptoms are shown, but at the start of the disease, the symptoms depend entirely on what part of the brain is being affected. If dementia is caused by a vitamin deficiency, it can be treated with supplements, but the most common forms of dementia are unfortunately incurable. There are medications which can help with the symptoms, however, it is a progressive disease, so medication will have to be reviewed frequently. There are medications to treat hallucinations and irrational behaviour as well as depression, which is a common issue for people with dementia. If any of these would be beneficial to your relative, then speak to your GP or nurse about what is available. Just because your relative has been diagnosed with dementia does not mean they can't continue to live an independent lifestyle. There are many different ways to help your relative, such as having a daily newspaper to help them remember the date, or having a list of important contacts and their phone numbers by the telephone. On a daily basis, it can be helpful to encourage your relative to have a routine, a place for every object, and to keep a journal so they can check what they've done recently. Whilst trying to complete tasks such as cooking dinner, it may be useful to break these down into smaller steps, doing one thing at a time. Avoiding noisy and crowded environments can help your relative, as different distractions may make them become confused. As the disease progresses, your relative may need more help with day-to-day activities. These include personal care and help with meeting nutritional requirements, but they can stay in their own homes with the help of community carers if they wish. In the last stages of the disease, it can become very difficult to care for someone with dementia. Their memory loss is likely to become very severe, and they may not remember the people who were once closest to them anymore. It is also likely that a person in the end stages of dementia become bedbound, as well as having issues with continence and communication. Commonly, people lose weight towards the end of the disease, although there are also occasions where people overeat and put on weight. It is important to monitor a person's eating towards the end of the disease, as they may need to have a specialised diet, for instance pureed food and thickened liquids. This is due to the individual's muscles and reflexes becoming impaired. It is also impossible to say how long a person will live with dementia, as it depends when the person is diagnosed. Unfortunately, there is evidence which states that a person's life expectancy is dramatically shortened when diagnosed with the disease. It can be very difficult to care for someone with dementia, being both physically and emotionally tiring. However, there are approximately 670,000 people in the UK who care, unpaid, for relatives or friends with dementia, so you are not alone. There are groups that meet, such as the Approach Cafes, which is a monthly meeting for people who care for other people with a mental illness such as dementia. These groups can be very helpful to help relieve stress and speak to people who are going through similar situations. Respite is also available for your relative if you feel like you need a break. Your relative would move into a centre for a period of time so that you could have a break from being a carer and can also give your relative a mini holiday. However, if you feel that you are struggling to cope with your relative, you can contact social services who can do a carer's assessment to gain support from your local authority. For more information on dementia and support available, please visit the Alzheimer's Society website or NHS Choices. Alternatively, complete the quiz to find out what you have learned.